Hi there, I am Ramesh, your soft skill trainer. And today you are going to learn about how to overcome anxiety. Today you are going to learn about how to overcome anxiety. And what is anxiety here? It is very unpleasant feeling of fear. It is very unpleasant feeling of fear. And why do people keep on experiencing the anxiety? So many reasons we have here. And what are the basic symptoms here? Whenever somebody start feeling anxiety, what are the basic symptoms we can feel here? Sweating, okay, immediately sweating, rapid heartbeat, so something here, lack of appetite, they don't feel like hungry, and sleeplessness, and also shortness of breath, and dizziness, feeling as the spinning around, okay, feeling as if spinning around, and diarrhea, and they don't get digest properly. Why all these reasons we can observe when a person have anxiety? So it is a sort of fear also. It is very unpleasant feeling of fear. And whenever the fear comes, we know that sympathetic system and parasympathetic system in our body we have, particularly sympathetic system will be activated. So that you can't understand here. So mainly symptoms, whatever the, so uneasy, particularly diarrhea, or sometimes fainting off. These are the symptoms we can observe whenever the person gets anxiety. And what are the types of anxieties? Why anxieties is to develop? Anxiety used to develop any unresolved fear or unresolved like any desires at the childhood, unresolved desires, and unable to reach some dream or desire at the childhood, that also leads to anxiety. Or whenever some, mostly I would say here, they are in a state of anxiety, nothing but state of mind also leads to anxiety. So those are the basic reasons. So at the childhood they were abused verbally or physically, whatever, okay, at the childhood they were abused physically, verbally, and they are aversion from the society, or they don't even mingle with the rest of the people, or so many barriers they have. That is also one of the reasons for anxiety. They cannot speak publicly. I observed some people cannot speak publicly. That is also one sort of phobia. So here mainly anxiety leads to different phobias. Anxiety leads to different phobias. Now we see what are the different types of anxiety and phobias. Here generalized one, in anxiety generalized one. So here it consists unexplained intense fear, unexplained intense fear. And here uh, what are the symptoms here? So apprehension feeling, nothing but they keep on bothering about the future, keep on bothered about future. So some, or else scanning environment for dangers, they scan environment for dangers. These are the things we can observe in case of generalized one. And they don't have interest on objects, mainly they have some, like the mindset or state of mind only mainly a reason for this generalized one. They experience every time intense fear, and they experience every time like scanning for some environment danger. And also they keep on bothering about the future things, what are going to happen, what is going to happen. That is about the generalized one. And coming to the panic disorders, so here panic disorder nothing but recurrent anxiety, it is keep on bursting, recurrent anxiety. This is the, and feel like a terror, intense terror, recurrent anxiety, and which leads to intense terror. Here the symptoms we can find, they fear about lizard, and they don't want to enter in that room where lizard used to be there. Or else they're unable to speak to the public, or unable to travel in a lift, unable to travel in a lift, or fear about some lizard and unable to enter in that room, or unable to speak a word even though they rehearsed very well. So these are all some sort of phobias. Okay, what are the different types of phobias we can find here? Mainly specific and social and agoraphobia. Specific, social and agoraphobia. Specific, nothing but here irrational fear. There is no specific cause. There is no specific cause. That is irrational fear. And social phobias, they are embracing when they are presenting something before public. They are embracing, or they are speaking or presenting. They have phobia or fear. Okay, that is a social phobia. And agoraphobia, agoraphobia nothing but here mainly the ability to carry out some normal activities also they can't do, because of they don't want to come out, or they can't experience the new circumstances. Agoraphobia nothing but they can't experience the new circumstances. That is agoraphobia. These are the different types of phobias. And one more thing, like we have seen one movie, that is obsessive compulsive disorder. Obsessive compulsive disorder. What is obsessive? Inability to stop thinking, that is obsessive. Inability to stop thinking, that is obsessive. And compulsive, they unable to control, like they keep on doing. Unable, inability to control something. Okay, that is compulsive behavior. They know they want to perform again and again. They want to perform again and again. That is compulsive behavior. And obsessive, the inability to stop thinking. So these together we can call it obsessive compulsive disorder. Here, what are some of the examples here? Mainly keep on hand washing and counting and touching, checking, ordering. All these are examples for obsessive compulsive disorder. And here next one we will go for post traumatic stress. Post traumatic stress, particularly this post traumatic stress we can see in case of natural disaster, in case of natural disaster and bomb blast and tsunami, and at the age of childhood also, or some particularly women, we can find that when they were sexually abused, that also leads to post traumatic stress disorder. Post traumatic stress disorder. So they keep on recalling whatever the painful dreams, thoughts, flashbacks, which keep on bursting their mind, or keep on bursting their thoughts. Okay, so here post traumatic stress, particularly we can observe bomb blasts or natural disasters, and tsunami, something like in case of Chennai was happened, this tsunami, and so many Indonesia. So this type of whenever that victims keep on recalling that panic things, and they fear about, or they create anxiety themselves. And somatoform disorders, they are not physically um, deceased, but they keep on thinking that they were physically deceased. Okay, this is also one type of anxiety. They are not physically ill, but they think they are physically ill. And hypochondrias nothing but these are keep on worry about health. These people are keep on worry about their health. That is hypochondrias. And dissociative disorder, they run away from the stressful situation. They run away from the stressful situation. That is dissociation disorder. They run away from the stressful situation. Or here we can find amnesia also. Amnesia nothing but loss of memory. Okay, so that is how these are the different types of anxiety, and how to resolve. What are the remedies to manage all these? First and foremost, what is the cause lead to any sort of problem? What is the cause lead to any sort of problem? Here mainly conflicts. Okay, so conflicts nothing but how you oh, how your mind chattering yourself, how your mind chattering yourself, or else, like interpersonal conflicts will be there. Interpersonal conflicts, how you communicate yourself, how you communicate with co-friends or colleagues, all these. So that is interpersonal, intrapersonal and nothing but how you communicate. Interpersonal, how you communicate with co-fellow or co-friend, that you have to analyze. And first and foremost you have to question why you are getting anxiety, and how did the causes come to existence, how did the causes come to existence. So here the whatever the golden statement for this anxiety: unfulfilled desires of childhood, unfulfilled desires of childhood, unresolved childhood fears. These are the reasons which transform into anxiety or fear. Unresolved childhood fear, unfulfilled desires of childhood. So that is the reason here, my friends. So whoever watching this video, please share it and recommend it, review it, because day to day here whatever the verbal abuse or sexual abuse increasing, that is the reason. So women getting anxiety, which leads to killing the families also, because women used to care the family. So we are going to kill the family if we start abusing even verbally also. It may lead to so many other things. That is the reason here we should not verbally or physically or sexually abuse somebody, which kills the family. When family kills, society kills. When society kills, total country will be killed. That is the reason, my friends, here improve right communication, not the wrong one. And so coming to the therapy or treatment, here they can consult initially a psychologist. They can consult a psychologist who are under anxiety, followed by psychiatrist. Initially they can consult a psychologist followed by psychiatrist. Why they have to consult initially psychologist? Because they can go for some psychotherapy. Why they have to undergo for psychotherapy? Because initially the moment they went to, suppose they went to psychiatrist, what happens, they start prescribing the medicine, antipsychotics or sleeping pills, I would say sedative hypnotics, nothing but sleeping pills, antidepressants, selective serotonin inhibitors, fluoxetine. So what are the different drugs? Okay, these drugs mainly initially it is good for therapy, followed by you are going to addict with the drugs. Like sleeplessness is also one of the thing. That is the reason they keep on administering to get sleep. So initially it is good, but followed by they are going to addict with the drug. And I have seen that some people are using this medicine lifetime they are using, like food how you eat, in the same way they are taking this medicine every day. Every day 2 pills, it will kill anybody. Every day 2 pills kill anybody. That is the reason, my friends, initially go for psychologist and get counseling. Whoever the client, just reveal your things, what are the different sort of problems you are facing, or what are the anxiety states you have, or conflicts you have. Everything you can share with the psychologist, and they'll give both psychodynamic therapy and behavioral therapy. Here they'll go into your dreams, or the way you think, and your behavior, your childhood experiences, everything will they'll take, and they'll give right therapy, or they'll counsel you, or they will ask you to change some sort of habits, because habits make your behavior. And the way you think also depends on environment. The way you think also depends on past experiences. The way you think also depends on everyday what you read, or everyday what you do. All these also influence. That is the reason you have to change your environment, and you have to change your mental pattern by doing different activities. If you fear about something, you have to do the same activity. Then also you slowly build up some sort of confidence, belief, both belief because of what you think about yourself, and also based on the some whatever the atmosphere where you are. Okay, social pressure also creates, so better try to face it, conquer them. And first of all, you have to find what is the basic reason, then you can come out. So that is how here better go for counseling therapy followed by psychiatrist. If it is unable to manage or treated by therapy, particularly this psychologist, then you can go for psychiatrist. That is the therapy, and the tagline is, first you question yourself why I keep on get anxiety, and try to resolve yourself also, or take the help. If you are unable to resolve, take the help from the psychiatrist or any counselor. Thank you, my friends. Thank you so much. And I am Ramesh, your soft skill trainer. Please recommend and please subscribe my channel, Ramesh Reddy Life Skills Academy. Ramesh Reddy Life Skills Academy. Please subscribe. Thank you. Thank you a lot.